Welcome to Tuesday's coverage of COVID-19. Starting today, tougher social distancing measures are in place across the country, with level 2.5 in the metropolitan region and level 2 elsewhere. According to authorities, they are no longer fighting sporadic cluster infections, but instead tackling persistent, widespread transmissions across the country. I have our Kwon So standing by with the latest on the pandemic for this Tuesday. Now, So do start us off with the situation on the local front.
Sunny, we have a slight decline of COVID-19 cases this Tuesday, but it's really not a significant development because we still have cases at almost 600 reported this Tuesday. And I'm saying it's not a significant drop because less than 12,000 screenings were conducted on Monday, and that is around half of the number that we have been seeing on recent work days. And it's also less than the tests conducted on Sunday. But the positivity rate hit almost 5%, which means 5 people out of 100 who tested for the virus were confirmed with COVID-19. And with that, the country has a total of 38,755 infections. We also have 3 deaths reported in the past day, raising the death toll to 552. Now, if we take a look at our graph now, we have been seeing 500s and 600s mostly in the past week, and authorities say that we are likely to see this kind of trend continue for the time being. Now, cluster infections continued to break out this Monday across the nation. In fact, all 17 provinces and major cities have confirmed new cases. We will hear in our later briefing on the major cluster infections in a bit. And due to this rising cases, that prompted authorities recently to reduce risk factors. So by raising social distancing measures to level 2.5 in the metropolitan region and level 2 in all other parts of the country. So enhanced restrictions to gatherings and facilities will start today and will last for 3 weeks. Hope is nearing, though, because Korea announced today that it secured COVID-19 vaccines for 44 million people, which means around 88% of the nation's population. We will have an in-depth look about that with our reporter Kim Da-mi in a bit.
Right, that is true. So right after this segment, that is. Elsewhere, I understand vaccinations are poised to start on this Tuesday in the UK.
Yes, Sunny, we're speaking about Pfizer-BioNTech vaccine, which will eventually arrive here in Korea too. But as Sunny just said, UK citizens are set to receive the shots beginning Tuesday local time, also dubbed the V-Day there. Now, elderly and nursing home workers will be among the first to receive the shots. Let's hear from the health minister in the UK about the anticipation there.
When we roll out the coronavirus vaccine across the whole of the UK, and it's the beginning of the end of this pandemic. We're not there yet. It's so important that people keep doing the things we know we need to do, following the rules and the basics to make sure we keep this under control. But we can now see the light at the end of the tunnel.
And Canada announced it's getting Pfizer vaccines delivered by the end of the year, and the U.S. will start its inoculations by this month as well. And those are countries that are seeing over 209,000 cases in the past day, 14,700 in the U.K., and also Canada with almost 6,500 infections reported in the past day. Let's take a quick look at other countries. Serious condition in Turkey here, which saw some 32,000 infections reported in the past 24 hours. And with that, the global COVID-19 figure stands at around 67.9 million. And those are the numbers I have for now. I'll be back after the government briefing. Sunny?
All right, so thank you for that. Back on the local front, health authorities are hoping to secure vaccines for about 90% of the population. For more on these intentions, I have our Kim Da-mi here in the studio. Welcome back, Da-mi.
Good afternoon, Sunny.
So to start us off with the government's announcement earlier today on its vaccine strategy.
Right, the Korean government says it is looking to secure enough vaccines for 44 million people, and that's 14 more million what the government had originally planned.
The government has secured enough vaccines for 10 million people through the COVAX facility. The government will pre-order 64 million doses for 34 million people from global drug makers.
The government will each purchase 20 million doses from AstraZeneca, Pfizer, and Moderna, which require 2 shots per person. Another 4 million will be secured from Johnson & Johnson's, which requires 1 shot. Park said the health ministry has already signed a deal with AstraZeneca and will proceed contracts with the 3 other companies later this month. Now, the vaccines for 44 million people will be able to cover almost 90% of the country's population. It is expected to be shipped as early as February, but details of the vaccination program, like the exact vaccination dates, are yet to be decided. The health minister noted that the effects of the vaccination program could be maximized if it began in the latter half of next year. The most vulnerable groups, like the elderly and frontline healthcare workers, will be the first to get vaccinated. Excuse me. Plus, the health ministry will also create a task force to oversee the nationwide vaccine program, like the cold chain management for vaccines that require low storage temperatures.
Right, Tami. Meanwhile, President Moon Jae-in has called on the government to deploy all of its resources, I understand, to contain this latest outbreak.
Right. South Korean President Moon Jae-in stressed that the situation is more serious than ever, warning of an uncontrollable nationwide pandemic if the virus cannot be swiftly contained.
다시 단계를 격상함으로써 국민들께 더 큰 부담과 불편을 드리게 되어 매우 송구하고 무거운 마음입니다. 정부는 백신과 치료제가 사용될 때까지 코로나 확산세를 차단할 수 있는 마지막 고비라고 인식하고 비상한 각오로 방역에 총력을 기울이겠습니다.
President Moon has also ordered the government to mobilize all available manpower, including civil servants, the military, and police, to strengthen the country's contact tracing capacity and to extend the operating hours of COVID-19 screening centers to include late evenings and weekends. Large-scale drive-through test centers will also be set up in the greater Seoul area. Korea will also roll out rapid antigen tests in the capital area starting next week. The test results come out within 15 minutes with more than 90% accuracy compared to the existing RT-PCR tests, which take about 6 hours. The president also urged people to get tested if they suspect they have the virus, even if they don't have symptoms, and called them to avoid gatherings and travel, especially ahead of the Christmas holiday season.
And starting today, as we've been announcing since yesterday, the Greater Seoul area is now subject to level 2.5 social distancing measures. Tami, tell us a bit about the enhanced precautions.
Right, so level 2 social distancing is the second highest in the country's 5-stage alert system. And that means that thousands of establishments must close and operations of many others will be restricted. And that includes gyms.
The main problem is that gym users need to exercise for at least 3 weeks to have a routine. But with the government issuing restrictions almost every 3 weeks, customers are losing the desire to work out, which has made it hard for us to run this business.
On top of that, singing rooms were allowed to open until 9 p.m., but now they'll be completely closed for 3 weeks. And 9 p.m. closing times will apply to movie theaters, internet cafes, hair salons, and department stores. Weddings and funerals all are limited to 50 people, and places of worship can only hold virtual religious services. Restrictions on coffee shops and restaurants will remain in place, meaning takeout for only cafes and delivery services for restaurants after 9 p.m. Despite many places being shut down, one person thinks that these tougher measures are necessary.
I think the stricter social distancing measures are a good idea because we've seen a rising number of cases since Halloween in October. I think it's better to have restrictions in place now that we're approaching the holidays.
In the meantime, health authorities have warned that daily caseloads could top the 1,000 mark, which could lead to the adoption of level 3 distancing measures.
I see. All right, Tami, thank you very much for that coverage.
My pleasure.
Right, it's time now for the regular briefing on COVID-19 here in Korea for this Tuesday.
First of all, we have Mr. Kwon Junuk with the briefing. Let us now begin our regular briefing on the COVID-19 situation here in South Korea for December 8th. As of today midnight, we have 566 new local infections, and the total caseload now stands at 38,755. And we have 349 more people being discharged, while 8,553 people remain in quarantine. And there are 134 patients with severe or critical conditions, and we had 3 additional fatalities. I extend my deepest condolences to the deceased and the members of the bereaved families. Next, we will go over some major updates on our domestic infections by region. First of all, in the metropolitan area, starting off with Seoul, in relation to a restaurant in Yongsan-gu district, we have a total of 19 cases now. And in Chunggu, we have a market where 14 cases have been reported as to date. And also in Jongno-gu district, in relation to a restaurant as well as a singing class, we also identified 51 additional cases, and now 162 people have been confirmed to date. And in Gyeonggi-do province, Yangpyeong, we also have the residents there. We have 9 additional cases, and 57 have been reported so far. And in the non-metropolitan area, in relation to a resident in the Chungcheongnam-do province, we also have additional cases there. And in Busan, in relation to a restaurant, we have 16 additional cases. And also in Gangseogu, we have 10 cases in relation to an environment agency. And in Jeonbuk, in relation to an automobile plant in Wanju, we also have additional cases. And in Ulsan, in relation to the nursing hospital in Namgu district, we have 8 additional cases, raising the total to 100 to date. And in Gyeongsang-namdo province in Kimhae, in relation to a nursing care center, we have 3 additional cases, raising the total to 30. And next, let us now go over our updates on our vaccines as well as therapeutics. First, the clinical trials for the blood plasma treatment. The second trials are carried out at 12 hospitals, and a total of 28 have signed up so far. And also in relation to the donations for the blood plasma samples, a total of 6,800 people have exerted their intentions to donate their blood, and about more than 4,000 people have also donated their blood, actually. And we also like to extend our deepest gratitude to the Korean Red Cross as well as the religious circles. And as for the antibody treatment, we have also completed our the applications for the threshold of our participants, and we will be unrolling and unveiling the analysis results very soon. And starting from this year, we will also have clinical trials for the vaccines. We also ask for your full support in this aspect as well. And as for the vaccines, 2 types of DNA and also the 2 types of the other forms of DNA, other forms of vaccines are also planning to go into commence the clinical trials very soon. As for the remdesivir, at about 75 hospitals, it has been administered to about 1,038 patients. And an update on the analysis of our cluster infections in the 49th week, we have identified major cluster infections at office buildings as well as hospitals. And also we have been witnessing cluster infections at other multi-use facilities as well as other family group meetings. And also the companies and the nursing hospitals and other clinics have also intensified their quarantine measures. However, we have been witnessing the cluster infections nevertheless, so it is very important to comply with the quarantine measures going forward as well. And next, as for the life treatment measures, the safety e-reports, we have the safety e-report run by the Safety Ministry right now, and there are many reports of violations of not wearing face masks and also non-compliance to the social distancing measures, and these have been reported so far. And also we have seen the cases of breaches at hotels. And as for a hotel, they changed the reservations under a different party room, and also they have notified their users that they can use these services and these facilities. And also the participants from a foreign school here in Korea also had a gathering. However, they did not wear face masks. And also at some hotels, people did not wear face masks after 9 p.m. and the hotel lounges were also operated after 9 p.m. and they did not have the visitor log as well, so these have been reported so far. And the quarantine authorities would like to note that starting from midnight today, we have put in place the level 2.5 in the metropolitan area and level 2 in the non-metropolitan area for the next 3 weeks. And we will also like to ask for your participation going forward. We tell you this multiple times, but if you are living in the metropolitan area, please refrain from moving outdoors, and also please refrain from visiting high-risk facilities as well. And to this end, many office workers are asked to work from home. And also, we are having remote classes for many private academies. And we are asking the residents in the metropolitan area to refrain from visiting non-metropolitan areas as well. And after the 9 p.m., we are also having restrictions on the businesses like restaurants. And we are also limiting the people at weddings to lower than 50. And we also have a gathering ban on party rooms and so forth. And also indoor sports gyms as well as singing rooms are also banned. And also sitting in at the cafes are banned as well. Only takeout and delivery is possible. And we ask you to refrain from visiting the saunas and public baths as well. And all of the gatherings at the religious centers will also have to be suspended. And in other regions as well, we have the discretion given to the local authorities to adjust their measures. However, the restaurants can only have takeout after 9 p.m. and all of the 5 nightlife entertainment venues are asked to be shut. And also there are many other intensified, toughened quarantine measures. And we ask you to continue to wear your face mask at all times, even when you are at the non-metropolitan area as well. And all of the events, including weddings, need to restrict their users to lower than 100. And the quarantine authority would like to also note that there have been many further infections stemming from cluster infections where people did not wear face masks. And we would also like to once again highlight the importance of wearing of your face mask. Recently at a restaurant and in relation to a singing class in Jongno-gu district in Seoul City, we have seen that these were facilities where they dined when they watched these shows, and the users as well as the performers did not wear face masks, and there were numerous cases being confirmed at this venue. And as we told you so far, we have 162 cases so far, and those over the age of 60 account for 70% of the total cases. Therefore, we ask you to refrain from visiting multi-use facilities that are crowded, closed and crowded and confined and close contact environment, and wear your face mask at all times. Last but not least, we would also like to highlight once again the following. We ask you to refrain from going to crowded areas, and also cancel all of gatherings and your meetings and events. And please wear your face mask, ventilate your space on a regular basis, and disinfect your area as well. At the same time, if you have any suspected symptoms, please visit a screening clinic or a hospital, or even a designated clinic for respiratory diseases. Last but not least, we would like to note the following. The COVID-19 pandemic has brought about a great challenge here in South Korea, and despite our public's continued efforts to participate in quarantine measures and social distancing measures, we are seeing daily cases hovering around 600, and we are very much concerned about a medical collapse and a breakdown of our medical capacity as well. At the same time, we are also waiting to have the effects of the social distancing measures and tightened measures as well. And as we explained multiple times, we should think that there should be no physical meetings during the year end, and also have further restrictions on movement. So the quarantine authorities will also exert our full efforts and to make sure that we have no disturbance and disruption in our medical capacity. Currently, the PCR testings, and on top of this PCR testings, it is very important to have a very early testings, and we will also have the saliva sample testings on top of our plans for the antigen testings as well, and also as for the high-risk facilities and regions, we will have swift measures to identify the cases. And we will also exert our full efforts and cooperate with the upper-level hospitals to secure more hospital beds for the critically ill patients. As mentioned before, we need to highlight the importance of the wearing a face mask on top of the social distancing measures. When you are having dialogue or singing, or when you are breathing even, and when you are inhaling or exhaling, you can disclose and you can spread the COVID-19 virus. So if you wear your face mask properly at a confined space, we have many models and examples where people were able to curb further spread. And there are many critically ill patients as well as senior patients, and it is very important to note that wearing face mask is the best protection for you and your family and your loved ones against the virus. In particular, all of the people, including the office workers, there are many cases when people cannot visit the restaurants. However, when you are at these restaurants, when you are wearing, it is very important that you wear a face mask when you are not consuming food. This morning, we had the government's briefing on securing of COVID-19 vaccines. In order to have our actual vaccinations, we need very delicate preparations. The quarantine authorities will also exert our full efforts to prioritize for the safety and the swiftness and the efficacy of the vaccines. There are cases and there are countries where vaccinations will begin first, and we will monitor the situations and we will also fully prepare. However, before we have vaccines, and even when we have the inoculations here in South Korea, it is very important that we have the fully development of our treatment actually, and also it is very important that these treatments that are made with homegrown technology here in South Korea are also in the final stages of development, and also our vaccines that are developed in South Korea are also in its final stages of the clinical trials. So we ask you to continue to participate in these clinical trials, and we also extend our deepest gratitude to all of you. Now we are nearing an end to our battle against the COVID-19. I know that this is a great challenge. However, it is very important that we overcome the challenge and prepare for a safe 2021, and we need to refrain from having physical gatherings and also have no breaches of quarantine measures and have a safe year-end holiday. Thank you very much.
Right, that was Kwon Jun-wook at the Central Disease Control Headquarters with Tuesday's afternoon briefing. So what did he have to say?
Well, first off, he had an update on the recent infections, the cluster infections which broke out at places of day-to-day activities like restaurants, markets, a singing class, as well as a car factory. And with that, Kwon emphasized that we cannot emphasize enough how important it is to wear masks properly. For instance, he mentioned an example where in the capital Seoul at a restaurant where a musical performance was held, people got infected. There are a total of 162 cases linked to that cluster because people did not wear the masks properly, which goes for the performers as well as the visitors there. So with that, wearing masks and also abiding by the social distancing measures, which have been enhanced, and with the enhancement having started today, is important. Kwon also mentioned that after we had that announcement about the securement of vaccines from abroad, here in Korea, domestically developed vaccination as well as treatments are in their final stages of experiments, and that's also why he called on cooperation from the nation's people regarding that as well.
All right, so thank you for that. I'll see you again tomorrow.
See you tomorrow.
Right. Not only has the pandemic disrupted the retail industry, it's also ushering in a new shopping trend, one that allows consumers to virtually try on makeup and even clothes without worrying about coronavirus contagion. Do take a look.
The year-end holiday season is usually the busiest shopping days of the year, but department stores have turned quiet amid the COVID-19 pandemic, with many customers avoiding brick-and-mortar establishments for fear of being infected. In one corner of this department store, this glitzy makeup shop has over 1,400 products on display. To minimize contact and help customers feel safe, this cosmetic store has installed an augmented reality device that allows people to simulate makeup simply by standing in front of a monitor.
고객님 테스터를 하지 않으셔도 AR 기기를 통해서 이렇게 여러 가지의 메이크업 룩을 고객님께서 가상 체험으로 해보실 수 있으시거든요.
This AR makeup service allows people to see how they look with makeup on without having to actually apply them. All you have to do is stand in front of this kiosk and choose which type of makeup you want to put on.
요즘엔 아무래도 코로나 때문에 매장에 와서 이제 테스트 해볼 때 그 테스터가 이제 어떤 분이 쓴지도 모르고 약간 좀 많이 불안한 부분도 있고 했는데 AR인데도 불구하고 진짜 마치 정말 제 눈에 한 것 같은 좀 되게 자연스럽게
좀 언택트가 대두가 되고 있는 만큼 좀 그런 것들을 중요히 생각하시는 분들은 이제 AR 메이크업 기계에서는 립이라든지 아이라든지 파운데이션 모든 부분을 직접 발라보지 않고 증강현실로 느껴볼 수 있어서 고객 경험적인 요소가 좀 더 부각이 됐던 것 같습니다. 지금 현재에도 고객들이 시연을 하시면서 만족도가 더 높아 있고요. 지금 이 메이크업 디바이스 덕분에 그 매장 만족도 자체는 상당히 올라간 걸로 보이고 있습니다.
AR technology has also been embraced by the fashion industry. This department store is holding a rather unique sales event, featuring many big-name clothing brands. Customers who want to try them on line up in front of the screen, instead of a changing room. This virtual dressing room creates a 3D pattern of the clothing, which is overlaid on top of a human model to give people a better idea of how they fit.
아무래도 코로나 시국이다 보니까 매장에 가가지고 옷을 입어보는 게 좀 부담스러웠는데 좀 간접적으로 어떤 느낌인지 옷을 입어보지 않고도 볼 수 있어서 좀 좋았던 것 같아요.
이런 시스템 자체를 처음 봐서 어색하긴 한데 앞으로 더 많은 브랜드를 볼 수 있었으면 더 좋을 것 같다는 생각이 들었어요.
The maker of this VR dressing room plans to upgrade the technology to allow customers to see how the clothing fits with their own body size and shape.
그 패션 쪽은 다른 서비스들과 다르게 굉장히 고퀄리티의 사진과 그런 영상들이 요구되는 서비스 영역입니다. 그러다 보니까 이 콘텐츠들이 빠르게 이동할 수 있는 그런 것들이 필요한데요. 향후에는 이런 네트워크 환경하에서 더욱더 자유로운 그런 시장이 열릴 것으로 기대되고 있습니다.
AR이나 VR이 사실은 어떻게 생각하면 어떤 미디어의 형태인 거예요. 지금 전달하고자 하는 정보나 제공해 싶은 경험이 이 AR, VR이라는 미디어 형태에 적합한가. 미디어의 어떤 그런 특성, 이것을 잘 생각을 하고 이걸 컨텐츠하고 잘 접목하는 그런 전략이 꼭 필요하다고 생각합니다.
The use of VR and AR technology is expected to grow amid this time of contact-free services. And experts are advising industry players to roll out the right content that focuses on delivering better customer experiences.
정상 간의 친서들의 교환이 있었고 당창건일 열병식장에서 우리에 대한 어떤 유화 조치들 그래도 내년도 상황을 우리가 좀 기대하면서 맞이할 수 있는 근거들은 좀
COVID-19 prevention measures are also evident across the border in North Korea. The reclusive regime continues to claim it has no cases of infection, but there are signs that the opposite is true. Now, for more on this, I have Dr. Ko Myung-hyun from the Asan Institute for Policy Studies. Welcome back, Dr. Ko.
Thanks for having me.
I also have Professor Lee Hoon-sang from Yonsei University joining our talk virtually. Good to see you again, Professor Lee.
Good to be here.
Professor Lee, Seoul's top diplomat, Kang Kyung-hwa, as you saw in the video, recently cast doubt on Pyongyang's claim of no COVID-19 cases, pointing to North Korea's drastic measures to control an outbreak that has reportedly yet to occur. Do you share her skepticism?
Actually, North Korea is highly securitized country with a massive level of surveillance to start with. So I think there is a quite high chance that they are quite under control, but they had been so far having about 8,500 suspected cases, and between October 29 and November 29, 2,400 classified cases was happening as a newly suspected cases. Although there is no confirmed cases, so far they have tested about 16,000 people for COVID-19. So even though they are reporting that there is no cases, and there is some likelihood that they are under extremely high tightening of the infectious disease surveillance and all the activities. But as the situation goes on, it might not be so easy to not have any cases, and we will, I think, have to continue to observe if the situation changes.
Right. Dr. Go, Foreign Minister Kang also said the pandemic has served to further isolate North Korea amid border closures and other such restrictions. Do you share her thoughts?
Oh, exactly. I think North Korea's preferred method of pandemic control is isolation, essentially a country-wide quarantine, so to speak, and it's a self-imposed isolation measure, so we cannot really blame the outside world for what's going on inside North Korea. And in a way, there's a long history of North Korea implementing this kind of extreme, from our point of view, extreme measures of quarantine dating back to the 1960s. Back then, the founder of North Korea, Kim Il-sung, defined socialist medicine as a preventive medicine. So essentially, they are taking this idea to the extreme, so to speak, and essentially they are isolating the entire country from as a possible transmission into the country. And in a way, it's actually irrational behavior on the part of North Koreans, because we know for a fact that North Korea doesn't really have a well-endowed healthcare system and or surveillance system for that matter. So so essentially they have to resort to primitive but effective quarantine measures.
Which means prevention.
Exactly.
Right. Meanwhile, there is talk that North Korea's Kim Jong-un has received an experimental coronavirus vaccine. Now, we spoke earlier to Harry Kazianis, a North Korea expert at the Center for the National Interest, for more on this assertion. Do take a look.
If we go back to February of this year, different Chinese officials have actually taken very early candidates of their own COVID-19 vaccines. And actually, back in October, the UAE's foreign minister took Sinopharm's phase 3 COVID-19 vaccine. And just to go a little bit further, and following with the UAE, their prime minister has actually taken Sinopharm's COVID-19 phase 3 vaccine for this. So it isn't that shocking, to be quite honest with you, that Kim Jong-un took this vaccine. And actually, to be quite honest, we're all going to be taking a vaccine that hasn't had the efficacy trials and the trials that so many other vaccines that we've taken since childhood. Kim Jong-un's regime is entirely dependent on Beijing for its own survival. whether that's economic, geopolitical. I mean, let's face it, North Korea would not survive as a nation state if it wasn't for China's help. So I think what this does for the Kim regime is it, unfortunately for Kim, it indebts him far more to China than I think that he would like. I think, not only is the Kim regime, been inoculated by China, but also the country itself is probably going to have to go to China for their population of 25 million people to be inoculated by Beijing as well. They've had food insecurity issues for, a decade or more. Now they're having to lock down the country because of COVID-19. It takes all of those different problems and makes them far worse. In fact, think about what the United States and South Korea and other countries have gone through. We're first world countries. We're able to adapt, take on debt, do public bailouts. We're able to do a lot of different things to mitigate the economic and societal damage that come from, a pandemic like COVID-19. Kim Jong-un can't do that. So I think for the Moon government, I think it's been very smart to try and offer as much aid as they can, even though the North Koreans haven't taken it. But I think it's important to continue to offer that olive branch.
Right. Professor Lee, going back to what Mr. Kaziani said earlier, what are your thoughts regarding the assertion that North Korea's Kim Jong-un has taken a Chinese vaccine against COVID-19?
Well, at this moment, we just do not have any concrete fact about that. So maybe Kim Jong-un has taken vaccine or not, but in my opinion, I think it is based on somewhat of circumstantial evidence. And what we can remember is that Kim Jong-un has studied in Switzerland, and he knows about some of the credential of the medicine in pharmaceuticals in the Western European countries or United States. So I think he would prefer to inoculate all of his people, whether the vaccine proves the safety or not, maybe just to improve the national health security. But as for taking the vaccine to himself, who is the highest figure and almost highly regarded figure in North Korea, I'm not 100% sure if that might be the case, because maybe rather than taking the risk of the vaccines safety regarded the concern himself, maybe I think he would have inoculate maybe people in the North Korea first for the public health purpose. Then maybe he might consider. So at this moment, I think my take is I'm not quite sure if he has taken it or not.
Right. Dr. Ko, what are your thoughts on the possibility of such a scenario?
So I agree 100% with Professor Lee in this regard that what Mr. Kaziani has presented are circumstantial evidences at best. And so it's unlikely that Kim Jong-un has tried to use Chinese origin COVID-19 vaccine on himself. And the reason is pretty simple. I mean, unlike some of the examples that Mr. Kaziani brought up as cases where a leadership level person in other countries have used the Chinese vaccines, unlike them, I mean, Kim Jong-un is irreplaceable in North Korea. I mean, if something happens to Kim Jong-un, no matter how minuscule the risk is, I mean, North Korea will undergo a structural, serious crisis, politically, economically, and strategically. So I'm sure that the leadership is trying to protect him as much as possible. And there's no hurry for North Korea. I mean, given what we have seen so far in North Korea, we have seen the broadcast of the Party Foundation parade back in October. We have seen that the people, not just Kim Jong-un, but the people in Pyongyang were going around without wearing the mask. So it indicates that at least in some parts of North Korea, at least in the environs of Pyongyang, COVID-19 might be under control. So there's no hurry for him to try an experimental drug on himself for now. But if Mr. Kaziani is right, it could be that it's an indication that North Korea might be engaged in a very interesting enterprise in the near future. The intriguing possibility is the possibility of Kim Jong-un visiting Beijing in the near future, because we know that North Korea is entering a new phase in terms of dealing with Washington. There's a new administration in Washington, and North Korea might be preparing to gear up its whatever strategic step it's about to embark on. So we know that in the past, North Korean leader would visit China and meet with Xi Jinping before we engage in such steps. So if that's the case, and then the visit is being prepared, they might be that Kim Jong-un might be at ease to use the vaccine before he leaves the country. So that's the only scenario in which I can imagine Kim Jong-un using the Chinese-made vaccine. But then, even then, that's the only possibility. And then for the rest, I would say that it's unlikely that he's using the Chinese-made vaccine.
I see. So you do agree that such an act of confidence by taking a Chinese vaccine, it would reflect positively on Pyongyang-Beijing relationship?
Oh, if that's the case, yes. I'm sure that the Chinese leadership would make an offer of supplying North Korea, not just for Kim Jong-un, but for the North Korean, the public in general, that they'll supply vaccines. But when it comes to at the personal level, when it comes to taking care of the top leader of North Korea, that's a different question. I think it's not so much about the relationship between China and North Korea. It's more about minimizing the risk for the only irreplaceable leader of the country.
Right. Professor Lee, North Korea's disengagement with the larger global community looks to hinder its efforts to secure vaccines. Do you believe that an international intervention is necessary in this regard?
Of course, I think it is necessary. First of all, it is necessary to in any part of the world, if you have any portion of the population who are not protected, it just is not good for the global community in general. Also thinking of the South Korea, it is it would be better to have North Korea, which is protected with the vaccines. At this moment, we are not sure. There seems to be no call from the North Korea for the global COVAX facilities. But I think it is. If there is any call from North Korea, I think for the humanitarian reason as well, and also for the protection of people outside of North Korea, including people of South Korea, I think it is. At the interest of all of us to make an effort to secure vaccine for North Korea.
Right, and staying with vaccines, Dr. Go, according to foreign media, North Korean hackers have been targeting major pharmaceutical companies, including those in the UK and the US. How do you interpret these activities?
So probably there are three possible explanations for what in regarding to North Korean attempts hacking into these pharmaceutical companies. One is intelligence gathering on the part of North Korea. North Korea is an isolated country in many ways, including the academic exchanges. So it's probably that North Korean scientists are hungry for new information about COVID-19, as well as the latest cutting-edge technology for vaccine development and production. So they are engaged in, they could have done it with normal journals, but being North Korea, they are engaged in illicit intelligence gathering efforts. Second is North Korean attempts to create have access to development of indigenous technology for vaccine development, and I think the same logic applies to a lot of countries right now. And North Korea is not going to be an exemption. And for more security reasons, even I think North Korea would rely on their own technology to develop vaccines, and instead of depending on outside help such as China's. So that's a possibility. And the most more unlikely but still a possibility is North Korean efforts to disrupt other countries' efforts to develop vaccines. North Korea in general benefited from chaos in the international scene. So if there's a more ongoing disorder in the international community because of lack of development in vaccine, that could benefit North Korea strategically. So it's a remote possibility, but it's still a possibility.
Right. Professor Lee, Unification Minister Arirang said that the safety of North Koreans equals that of South Koreans. Now, politics aside, as a medical professional, what are your thoughts on his words?
In overall regards, I would agree with him to large extent. For the public health point of view, having the situation where the COVID-19 pandemic is not being COVID-19 outbreak is not being controlled will not be helpful to South Korea. And if any of the possible situation happens where the rampant infections transmission happening in North Korea, and when if the situation deteriorates with any of the any kind of infectious disease, it just does not help for the people of South Korea. And another aspect is if there is any kind of large-scale deterioration of the public health situation in North Korea, it will cost more for either South Korea or for the global community to help. And it may also increase the chance that North Korea's dependency to China may increase as well. So overall, I think it is sound decisions to make a help to make an effort to help North Korea. But in this, on another regards, my take would be that we need to first work on the public health situation in South Korea first. I mean, we need to have our country, South Korea, to be secured for the COVID-19 control. And right now, we are seeing the third wave of the COVID-19 situations. And it is no small matter to regard it as a controllable situation. Always we have to fight the situation with our best. So I think one of the things is we need to focus on South Korea's situation first. Indeed. And also as for the vaccine, we need to make a most effort to secure the vaccine for the people of South Korea. Having said that, if we have enough vaccine for South Korea, and if we are under somewhat of a control, I think it just makes sense to also help North Korea to control the COVID-19 situation as well.
Right. Dr. Go, very briefly speaking, U.S. Deputy Secretary of State Stephen Biegun is visiting Seoul today for a 4-day visit. What is on his agenda?
Well, clearly, I mean, which probably easier to discuss what's probably not on his agenda. I mean, we know that the Trump administration is on their way out, despite what President Trump is claiming. So there's a less than, a little bit more than less than 2 months left for the Trump administration to engage in North Korea with new initiatives. So therefore, that's unlikely. So it's more likely is that Deputy Secretary Biegun is visiting Korea as a part of a tour to essentially to reassure the allies about the continuity of the U.S. foreign policy, no matter who's in charge of the White House. And also, it's a federal tour, so essentially business call, a courtesy call, and then essentially, send us a strong message of a strong alliance relationship between South Korea and the United States, and reaffirm some of the achievements of the Trump administration when it comes to their North Korea policy.
All right, Dr. Go, as always, thank you for your thoughts. And Professor Lee, thank you very much for joining us virtually.
Thank you.
Right, well, that is all the time we have for this edition of COVID-19. Do join us again tomorrow for broader coverage on the pandemic. In the meantime, thank you for watching.